Welcome everyone to the 200th episode of the podcast. So it's a great achievement, a great milestone, and I'm really proud of it. I mean, who would have, if I can say, bet on a podcast that can come every week during 200 weeks now and talking only about quality and regulatory affairs for medical devices. Even me, I was at the point I was saying, okay, maybe I will not have nothing else to say, but yeah, apparently this field is really filled of a lot of information, a lot of things that we have to share. And yeah, as we say, a medical device can go from a wheelchair, spectacle frames, to a pacemaker, to an MRI machine, to a lot of things. So yeah, there are a lot of things to talk about, and I'm really happy that we were able to continue this since now, if I can say. So just to explain to you how it will go today. So what I have done, and just to give you, if I can say, the behind the scene of this episode. So what I have done is that I have contacted few people. I have first mentioned that to my team. So I asked them if they would be interested to be part of it. I have also contacted some customers and I asked them if they would be part of it, some partners. So it's really something where I want to show you, and this is really the objective of this episode, that first, I am working here with Easy Medical Device to make this episode free of charge for anyone. To see that and to learn then. But the fact is also that I'm not only doing that, I have also a consulting firm behind that, and I want also to show to you the behind the scene with the people that are there, with also the achievement that we have done with some customers that are telling us, what they think about us. So there is a lot of things where I just give the if I can say, instruction to the people that will be making this video to make it like 2 minute short, if I can say, and also just to tell us more about what Easy Medical Device helped you to achieve this year, if I can say. So so it's why I will maybe move directly to the next part. We'll have first a discussion with my partner and co-manager, so Anindya Mukherjee. So he will give you a few words. We'll go also to talk about with some other people, if I can say. We have some people that were really benefiting from this podcast, so I wanted to have their testimonial also. We'll go also to the team, we'll go to the customers, we'll go also to the services that we are offering. We have also the training that we are offering, so we have also some people that were just giving us a testimonial on that. So today the objective is also to show you the behind the scene, because maybe you know Easy Medical Device just with the podcast or the videos that we are doing, but there is a lot behind it, and I just want to share with you that I am the face maybe that you are seeing, but behind me there is a lot of people that are helping and working hard sometimes to make things happening. So let's give the stage to them now, and we'll start with my partner, so with my co-founder, so Anindya Mukherjee, who is in charge of the UK office and who is helping a lot. And we have also a project in common that I wanted also to share with you.
And I'm very, very proud to announce that today we are completing 200th episode of the podcast. Well, I definitely, along with all the employees at Easy Medical Device, share the happiness. But there is one man who is making all the difference, and he is a bright shining light. So what does that mean? Well, I just checked the meaning of Munir in internet, and it says that it's the bright shining light. And we all know that we cannot think the quality and regulatory world in medical device without Munir. So it's like, what before Munir and what is now after Munir joined this industry, right? So he's a person who has been making the maximum contribution, a significant contribution, which has really changed the way the medical device regulations work across the globe. So Easy Medical Device is not just a name where Munir is doing podcast, but I joined here as the co-founder, and I'm the managing director. I'm having 20 years of experience. I'm an expert in the software as a medical device concepts, and we are a group of QARA who have been working over many years across the globe. Easy Medical Device is just not a company, but it's an institution where the concepts are discussed. And the main purpose, the main vision or mission of Munir and me and with the entire team is to make that significant contribution in the industry of medical devices, so that we reach out to the people with the best solution. And our goal is to make the compliance easy, and that is all about easy medical device. And I'm really, really proud to be the part of it. And I think not just me, along with all the employees who speaks very highly of Munir and Easy Medical Device, but I think it's the entire world. They are aware about what Munir, along with all of us, are doing. And now we also are in the phase where we have our own product. We do that with the brand of Smart Eye at SCube Technologies, which is also a company which is run by Munir and me. So come and join us and be the part of the family at Easy Medical Device, to get the best and correct and complete solution of the compliance of the regulatory and quality in medical device. Thank you so much.
Thanks, Anindya. And as I told you, we have also a project that we are sharing, which is Smart Eye with the company SCube Technologies. So Smart Eye is an electronic quality management system that we have just released. We have tested that with many customers, and now we have officially released that. So a lot of customers are using that. We are going through audits with our customers, so it's really great. So yeah, it was something that I wanted also to have on my portfolio of services, and this is now possible with SCube Technologies. So don't hesitate also to ask if you want to have a demo of it. Okay, on the next part, we'll talk with Alex. We have discussed with him about the benefit that the podcast provided to him, and he will share with us his experience from, if I can say, starting with not a lot of knowledge and then becoming more knowledgeable and being able then to execute some missions with that. So let's listen to Alex. Welcome, Alex. So thank you for joining here on this video, for sharing, if I can say, your experience with Easy Medical Device. I just want to maybe for you to introduce yourself first, and then we can talk about the topics.
Thanks, Munir. So I'm Alex Despotovic. I'm actually a medical doctor based in Belgrade, in Serbia. And for the past 6 years after moving away from clinical practice, I've become a clinician or a clinical kind of advisor in the medical device industry, mostly working on software as a medical device in the EU and to some extent in the US. But I've spent most of my time working on various stages of product development, from inception, crafting, intended use, all that kind of initial setup of how you come up with the definition of a product, all the way to market clearance and approvals and the regulatory submission. So very, very thankful for the opportunity to talk to you, and I've spent so many hours listening to you, and it's been I think one of the most important things that I've learned from you is I think people need to be continuously exposed to contents that you talk about, and it's often very difficult, even for me as a clinician who understands a lot of the things that are being said. There is a lot of nuance in for example, clinical evaluation or post-market surveillance, or all those different topics that seem kind of straightforward, but really you've been able to kind of dissect that in many ways, and it's been very helpful for me in listening to that. Some episodes I would watch multiple times because it's just too much content for me to absorb at once. So really thankful for you spending all this time to kind of help us educate all these different people in this space.
So was it so when we made those episodes, and as you said, for clinical evaluation, for example, we had many episodes because we consider that clinical evaluation is really the topic that is completely a really important priority number one for medical device manufacturers. So I think we had to look at it in many sides, if I can say, many people many people talking about that because of that. So was the content, if I can say, helpful to go practically to, if I can say, to be more practical? It was a lot of theory, and then you had, if I can say, to go more on learning about that.
Well, I guess it's both, but I think I think you did 2 episodes that really changed a lot of things that I do with Cesare Magri, about crafting the intended purpose and sufficient clinical evidence. And I think what people often don't understand, and myself included, even as a clinician, is what type of evidence do you need to generate at which stage of development? The concept about safety and usability, and then performance and benefit, all those things don't need to necessarily all be put into a clinical trial or a clinical study with patients. And being efficient in kind of deciding when do different components of the product get tested really helped me in my work, especially when I was working in the UK for a company that was working on remote patient monitoring using a software product, is which evidence do you collect, in the usability stages, and you don't need patients, or you do need patients, and you do need, consequently ethics approval and for you to be eligible to even publish that in a peer-reviewed journal. So that particular topic of, firstly identifying your product, what are its indications and what are the intended users and all those things, really made a difference for me in understanding all those different concepts. Because, historically as a clinician, you do a study and you do all those administrative things that you need to do, the ethics approval, if it's in the UK, you consult the MHRA, and it's months and months of work. But for many things, you don't necessarily need that. So that was a big revelation for me in, depending on the claims that you make about your product, the evidence that you need to generate. And that was really helpful. I think that was one of the biggest episodes for me, at least.
Great. So, I'm really happy for that, and it really helps me also to keep the motivation up for this. And I will just say maybe to Cesare that also what he has done was helping somebody to do that.
Oh, very helpful. No,
it's fine, because Cesare is also pinging me sometime and say, "Oh, let's talk about this on your podcast. Let's talk about that." So I have some topics with him that we are organizing now, and literature search, or software for research of literature and this and that. So he's really a passionate guy on clinical evaluation, clinical investigation, and I'm sure we have more episodes to share and to provide for the audience. So really, thank you for that, Alex. It was really a pleasure, and I'm really happy that it's helping you. And as I'm saying, so we have now 200 episodes, which means 200 weeks. Because we are doing that every week, one after the other. So I'm really happy that after that, we have some good outcome, like what you have said, related to the benefit that the podcast is providing to the people.
Oh, for sure. And keep it up, and 300 and 400 and so on. So it would be, keep it up. And I'm a passionate fan, and it's week in, week out. It's a helpful thing to listen.
Great. Thank you very much, Alex. And we have also stories of people that by, if I can say, listening to the podcast, they were able to graduate or able to get more knowledge about this field. And I'm really happy then to get this testimonial from Joanna Sandek. So thank you for that, Joanna.
Hi Monir, hi everyone. My name is Joanna Sandek. I'm Polish, but I work in Ireland as a quality engineer for McKesson. First time I heard about Monir over 2 years ago. At that time, I started my part-time master's in quality and regulatory medical device technology, and I was in a desperate need of some articles or podcasts that would clarify some of the MDR topics we discussed at school, and also I just wanted to perform my daily work tasks better. And one of my colleagues at work recommended me Monir and his podcast, and I'm really glad she did, because I've learned a lot. Thank you very much, Monir. In addition, thank you very much for agreeing to be participant of one of the interviews I performed a few months ago as a part of my dissertation, because I never had a chance to tell you, but just recently I got my results and I made it. I got my master's degree, and graduation will take place next month in University of Sligo. So again, thank you so much. Happy celebration of the episode number 200, and I'm sure this is just the beginning. Thank you.
So now you may know that at Easy Medical Device, we are also offering a training. Actually, I wanted to offer more, but it was a bit difficult to build everything. I'm still working on some of them now. So we are offering a green belt training. We are offering the mini course, which is free of charge that you can go and reserve emails and then learn and then get a certificate for it. And you can go for the green belt certification program for EUMDR. And we had a lot of person that were passing through this training. I didn't count all of them, but I should maybe have done that for this episode. So we have reserved also. I mean, we are now at the 20th edition. So for the training, so where we are teaching all about EUMDR, and we try to make it not really just theoretical. We are really placing a lot of practice information there, and I have a team that is really always coming to this training, and apparently any people that are coming to their company that are coming to the training also, which is Softmedica group in Romania. So let's listen to the team of Softmedica.
Hello Monir, hello everybody. My name is Cristina Miroescu and I'm Compliance Director of Softmedica Group, a company active in medtech industry in Europe since 1994. I am also a graduate of Green Belt certification program, one of the first sessions in 2020. Since then, Green Belt certification became a mandatory training for any quality and regulatory team members at Softmedica. Why? Because it satisfied our needs of information, of learning within our MDR readiness journey. So Green Belt certification offer very well structured, updated information in a very pleasant learning environment, which is enhanced by daily assignments and quizzes. And the final exam is really tough, under time pressure, which is preparing you for the daily business challenges. With his weekly podcast, Monir created a great community of experts in medical devices industry, and we can really rely on this information, on this community. Thank you very much, Monir. Thank you, Medical Devices, for everything you do, and moreover for delivering on your mission to train companies to place on the market medical devices, compliant medical devices. Thank you and keep up the good job. Bye bye.
Hello Monir. Hello everybody. My name is Larina Olteanu. I have recently graduated the Faculty of Medical Engineering and now I'm a Junior Quality and Regulatory Affairs Specialist at Softmedica Romania, which is an importer and distributor of medical devices. Because I'm a beginner in the medical device industry, I started to follow Easy Medical Device blog and podcast. Monir always gave us so much current, well-structured and very useful information. I just finished the course Green Belt Certificate, September 2022 edition, and before it, for me, MDR was like a puzzle. After this course, everything started to make sense and the pieces of the puzzle began to settle naturally one by one, thanks to the information, quizzes and assignments provided. Monir is very responsive to questions and he supports the participants along the way. So I would really like to thank you, Monir, and your team for all your efforts, and please, Easy Medical Device, keep up the good work.
So special thank you to them for their testimonials, and I hope if you are interested to be part of the next session, we have a session in end of October, end of November, and beginning of December, to just not put that also during the parties, the Christmas period. So if you want, you can go to the website and just register and enroll for those sessions. And so it's a 1 week session where I'm helping you within one item every day to learn more about the EUMDR. Some people told me that 1 week is really short. They wanted maybe to extend that in 2 weeks, but I wanted to make everything in 1 week so that we can, if I can say, go fast on this have a lot of learning, and as Christina said, there is also an exam at the end where I'm testing you, if I can say, if you learned a lot on this episode. So now what I want to do is to give also the opportunity to my team to speak out and to tell what they are doing or learning, if I can say, within Easy Medical Device. So we have some people that are coming as a trainee, we have some people that are just now starting as junior, we have some people that are senior more, they are here since since 1 year now. So the idea here is that they are the ones that are really helping me and working with me on the behind the scene, if I can say. So when you are contacting me and asking me for some consultancy, then I see who from my team can be also involved to help me to again offer you a great service, because I'm alone and I cannot do everything myself, so it's why I needed the team to help me also on that. So let's give them an opportunity to speak and to tell you more about what they are doing.
Hello everyone, my name is Miriam and I'm working as a QA/RA associate with Easy Medical Device. My journey with EMD started a few months back when I completed the Green Belt certification course. For someone who is new to regulatory, it was such a wonderful insight into the world of medical devices. The course was delivered exceptionally well by Munir, and everything was very easy to understand. It gave me a very in-depth understanding of medical device regulations. Since then, I have been able to assist and support the team on different projects like gap assessments and updating the procedures, etc., which has been such a wonderful learning experience for myself. I would just like to thank Munir for this amazing learning opportunity and for letting me be a part of his EMD team. It has been such an absolute pleasure, and I am looking forward to learning more from him and the rest of the team. Thank you very much.
Hello everybody, my name is Mateus. I'm based in Brazil and I'm part of Easy Medical Device team. And I would like to say that I started to learn about the MDR and quality assurance with Munir and Easy Medical Device videos on YouTube. And about 6 months ago, Munir gave me the opportunity to start to work as an intern. And today I am a junior consultant on the team, so I would like to thank you, Munir and Easy Medical Device, for this opportunity, and congratulations for this 200th episode. And I wish that you keep working on that direction, helping people and helping our clients to get better and to be better on our market. See you, goodbye.
Hello, I am Fatema Jahed, a medical device expert specializing in quality and regulatory affairs. I've been working with Easy Medical Device as a quality and regulatory engineer for a year. Working with Easy Medical Device was a great opportunity to be involved in an international team with the leadership of Munir. As all you know, working in QA/RA area causes a lot of pressure, a lot of stress in every project, including the implementation of new standards, new regulation, considering the situation we are faced with the new regulation of medical devices, or adapting each customer system to the requirements of ISO standards, and over tackling the inertia that exists. During all these challenges, the points which give us the job satisfaction and the inspiration to move on really are the support and leadership we always get from Munir, and the good impression comes from our team.
So just for clarification, this is not the entire team. I have few more people that are coming just after, and there are few people that were a bit shy, if I can say, to make a video. So as I said, it was really voluntary. I didn't pressure anybody to do the video and to say what they are saying. So okay, so now that we have, if I can say, you've seen a bit of the team. I wanted also to get some feedback or some testimonials from some of the companies that we are helping and where we had some successful outcomes. So I asked few customers, but not everybody was able to provide me a video on time because I really had made that in short notice. But I had few of them that accepted. So I will share with you now their testimonials from Odelia from Alma Lasers and Eric and Lenny from Medser that were, if I can say, where we helped them, if I can say, with the quality and regulatory affairs activities or missions that they had, and we are still continuing to help them. But yeah, they were really nice and to offer us those testimonials. So let's listen to them.
Hello, my name is Odelia and I'm the Director of Regulatory Affairs at Alma Lasers. We are manufacturing energy-based device for aesthetic and medical applications. Easy medical device has been helping us solving the many challenges that we are facing those days, especially in the field of aesthetic device and the Annex 16 of the MDR, which still require many clarifications. So thank you, Monia, for your great help dealing with all of that. Monia and his team are so available and easy to work with, and really a team of professionals. So I really recommend working with them. Monia, have a great 200 episode, and thank you again.
Hi, I'm Eric.
And I'm Lenny, and we are the founders of Medser AB in Sweden.
And we have developed a customized implant for bone regeneration. For this we need knowledge about materials, design, manufacturing and regulatory. But within the company we didn't have that much knowledge about the regulatory aspect from the beginning.
And Easy Medical and Monir, they helped us with this from the beginning by giving us the complete picture of what would be required to fulfill the MDR regulations.
And thanks to Monir and his team, we are now through this process and we have our first product on the market.
And with this, we would like to thank Easy Medical and wish you a happy 200th podcast episode. Thank you.
Okay, thanks again to Odelia and to Lenny and Eric for their testimonials. Was really appreciated. So let's move now to a service that we are offering, which is the authorized representative service. So we are offering that in Switzerland, in Europe, and in the UK. We have 3 offices. So I'm working with an India, for example, and other people for the other offices. But we have one person that is central to all these activities, and it is Nilima. So Nilima is part of my team now since a long time, and she's really helping us to all the communication with customers, the organization of the contracts and everything, and then we have just to review and sign and do all the activities with our customers. But she's a bit of central to all that, so I really thank her for all what she's doing, for all the satisfaction also that she's providing to customers, because customers are in contact directly with her, and at the end, if I can say, I don't get complaints from them, if I can say so. I really thank you, Nilima, and thanks also for this video that is also showing all the achievement that she has done, because all the result that is on this video is mainly because also of her. So thanks for being here and for helping us. So thank you, Nilima.
Hello, congratulations Monet that you are in 200 podcast episode. I'm very happy that you are in 200 podcast, and whatever you are releasing videos, it was really very helpful to the beginners who doesn't know about anything about medical. If you will be going to watch in that videos, we can get to know better, understand what is the medical, what is the regulation, how we need to create the technical documentation, or how to create the PMCF, or what is the label, or what is IFU, complete medical. We are getting to know very easily in your podcast episodes. It was really very helpful, and I'm very much thankful for this, to spreading this much of great knowledge to the entire people. So coming to myself, I'm Nilima Kalaila, who is working as an authorized representative of UK rep, Switzerland and in Belgium. And it was pleasure to work with Monir, and I'm grateful to say that we have almost registered 25 customers in UK rep. In MHIA portal we have registered, and in Switzerland we are going to around 30 customers we have registered in Switzerland, and in Belgium also we are registering the customers. And even I would like to say about the customers, what we have received the feedback from customers, that they are really very happy that they have chosen the correct authorized representative of Easy Medical Device, that they were giving very nice compliments, that what we are giving such a great clarifications easily, and they can understand better, know about completely what is their clarifications, everything. That is, we have received such type of compliments from the customers. I'm very pleasure that I'm working with you, Monir. It was really proud of working with you as a Easy Medical Device. Thank you so much for that. I would like to say, last but not least, about Monir. He was like such a liberal and wonderful person who is giving this type of great knowledge and spreading entire to the people. That is very grateful thing about him. Thank you so much, Monir. I wish we will be release more and more podcast episodes, and everyone should know completely about Easy Medical Device. What is Easy Medical Device means everyone get to know easily, right? That is. Thank you so much, Monir. Bye.
And we are offering also a new service, which is the importer or independent importer. So we are not making a lot of, I can say, advertisement of this because it's a new service and it needs really a lot of resources to review all the documents and all the products that are coming. So it means that also, yes, each time you are sending a product to the European Union, we have to review that and to check that. So I asked also Mohamed from my team in Belgium to help provide the video on that. So when I asked him to make this video, he was saying, oh, what should I say there? What should I make? I say, oh, you can say also that there are some mistakes that people are doing the same, but say it nicely, etc. But it was more like, I will do it more. Not happy. And you'll see on the video, he was really like trying to make it nice and things. But yeah, sometimes there are a lot of mistakes that customers are doing when they are sending the products, which are delaying, if I can say, the delivery of the attestation of release for the customers. And he always comes to me, oh, they are always making this mistake, they're always making that mistake. So I say, oh, tell them in the video then. So he tells you, if I can say nicely, that yeah, he's really happy to work with you, but you are making some mistakes. So let's listen to Mohamed now.
Hey everybody, hello my dearest customers. This is Mohamed from Belgium. Some of you already know me from the meetings we had. I am an importer. I help clients reviewing their products against the European and Swiss law so they can put the products on the market. I love it when you sending me the orders for checking and approval, but sometimes I find some issues like products are not listed on the declaration of conformity, so this one I can't accept it. But at the end we always find a solution for that, and I send you an attestation of release. Thank you for the orders you're sending me, and see you in the future. I think I was forgetting something. Monir, congratulations with your 200th episode. You're doing a great job. Thank you for that. Bye.
So thank you, Mohamed. And I said, yeah, you'll see at the end of the video also, he tried a lot of time to make this video, so it was a bit funny. Now let's talk also about my network of, if I can say, passionate people that I have also. I have few of them that will that are also accepting to make a video for that. So I mean, the important thing is that you have also to surround yourself with the right people, with people that can help you, that can also push you, that can motivate you, and these are the people that I'm really happy to be working with. So we have first Ivan Perez Chamorro from Medboard. So you will see that Ivan was the first guest also on my podcast, so it was important for me also that to have him here, because he's really a great professional, passionate with what he's doing, and Medboard is really a platform that you all need to know also. And we have also another person there, which is Cesare Magri, which is also helping me on a lot of my activities related also to clinical evaluation, and he's really a passionate person also on this. He has also a lot of, as I've said, a lot of things where he wants to share with you. He pings me also, oh, let's discuss about this, let's talk about that, let's share this. So it's somebody that you really like also to discuss with. When we have also some discussion about FDA, about notified body, about those things, so it's really some important people. So it's also to say that I am not alone. I have also a team. I have also a lot of people that are here. But the expert or the people that are surrounding me are also important for the success and for sharing with you also the right information there. So it's why also on the podcast we have a lot of recurring people like Eric Volbrecht, like TÜV Süd also that is helping. So thank you TÜV Süd, because I asked a lot of notified bodies and not everyone wanted to be part of the podcast, but TÜV Süd was always there and always accepting to share knowledge and share information, which is really appreciable. So let's listen now to those experts.
Hello Monir. I just wanted to send you this message to congratulate you for the 200 episodes of the Easy Medical Device podcast. It has been an incredible journey for you, and I'm so happy and glad that I witnessed that and I support you along the way. I remember back in the days when you asked me, would you like to be my first guest? And I said, why not? And we did it. It wasn't a complete disaster. And then since then, you just grown so much your podcast community, and you created one of the key references as well for the medical device industry. So this message as well is to say thank you. Thank you for bringing so many experts. Thank you for so many learning hours there, and as well free to the community. And as well, thank you for all the hours and effort you put into this. So I wish you another 200 episodes and all the successes, and just keep doing as well as you're doing.
Dear Monir, congratulations for the episode number 200 of your podcast. This is a really great achievement, and thank you for sharing all this useful information with the medical device community. It is really extremely useful what you're doing. And all the team of For Better Devices is really happy to work with you on creating clinical investigations and clinical evaluation of medical devices. And we really hope that we can continue working with you in the coming years and watching your episodes of your podcast. And good luck for your work, and thanks again for the useful activities. Bye-bye.
So now, just to finalize and to really also complete the loop, if I can say, so I want to thank you all, the ones that are listening to this podcast, the ones that are providing me comments, also the ones that are sharing with me that maybe it would be interesting to discuss about this topic or that topic, because mainly, without you, this podcast will not exist at all. It's mainly also my objective that you are getting some really interesting content. It's not just a promotion of people, promotion of companies, promotion of services. It's really providing some elements that will help you on your day-to-day activities to perform your job, so that you can also do it yourself. My mission is also to share with you knowledge that where you can do it yourself. And in case you cannot do it yourself, or you don't want, or you have no time, then I share with you also who can help you, like our company, so Easy Medical Device, or the experts that are also on this podcast that can help you for that. So yeah, thank you again. Thank you. So 200 episodes. So it's really something that I was not expecting at all. So now we are reaching that, and I hope we'll do another celebration for the 300 and the rest. So just a few more minutes. There is still I compiled a bit of some bloopers that happened during the recording of some of the videos that the people are doing. So they were nice enough to share with me some of the bloopers so that I can also place them on the end of this video. So thank you again. Thanks for all your support. And so this week normally we should have made the monthly episode, but I will put that in the next week then for you. So don't hesitate to also share with me if you have any comments or anything that you want to talk about. So contact me at info@easymedicaldevice.com. info@easymedicaldevice.com. Thank you very much for that. It was really a pleasure.
I'm helping clients to resume their products against the law of
And now let's introduce you to
Hey, hello there, dear lovely customers. Some of you already know me by email or
Hello Monir, I just wanted to send you a message to congratulate you for the 200 episodes that you can achieve this week. I remember back in the year and a few years ago. Hello Monir. Hello Monir, I just wanted to